Hi, good morning all. My name is Natasja Carmela, and right now I want to present my research with the topic of the effect of online learning factors on mental health among college students in DKI Jakarta and West Java during COVID-19 pandemic with my advisor Adita Pritasari. Okay, so let's jump right into the first chapter, that is Introduction. The emergence of the COVID-19 virus, which was originally found in Wuhan, China, spread quickly over the world, and it caused all nations to battle the coronavirus in early 2020. Unfortunately, on March 11, World Health Organization labeled this outbreak a global pandemic. This has an impact on all sectors in all countries, including Indonesia. So, as a preventive move against the disease further dissemination, a number of nations' educational institutions have been shut down. The government issued a policy for schools to hold online teaching and learning activities precisely on March 16, 2020. Next, therefore, because the conditions that mentioned earlier, there were several situations that arose among college students. As we know, everything has its own advantages and disadvantages, so does online learning. The first problem is that after online learning was implemented, it was discovered that certain students were mentally unwell and anxious, and therefore they can't follow the educational process appropriately. Second, the prevalence of anxiety and unhappiness increased dramatically by a startling 25%. Third, pandemic has affected young people's mental health, and they are at a disproportionate risk for suicidal and self-harming behaviors. So, the author came up with some of these questions. First, what factors can affect online learning students' mental health during COVID-19 pandemic, and what kind of strategies they can use to overcome mental health issues? The objective of this research is to identify factors significantly influences on the mental health of students and to provide suggestions to the students in participating online learning that can be used to overcome mental health problems. Researcher took students from state universities in DKI Jakarta and West Java, especially those in the third, fourth year and above, with considerations that they had participating in both offline and online learning, and the timeline for this research is from January to July 2022. A researcher using quantitative method by distributing online questionnaire to participants that with categories that mentioned above. Next, for the literature review. So, online learning is one type of distance learning, which is defined as any learning that occurs outside of a regular classroom. So basically, online learning is education that takes place over the internet. The term e-learning refers to education that carried out through information, communication, and technologies. And then from many previous studies that I have collected and filtered, I found several factors related to online learning which can cause mental issues on college students. There are those 8 common factors. There are excessive workload, internal capability, technical issues, lack of social interaction, economic problem and uncertainty of future employment, learning environment, fear of getting infected, and online learning quality. Next, mental health includes our emotional, psychological, and social well-being. It also helps determine how we handle stress, relate to others, and make choices. Meanwhile, mental disorders are conditions that affect our thinking, feeling, mood, and behavior. It also affects people's ability to relate to others and function each day. There are common types of mental disorders, but in this research, I will only took 3 types. There are stress, anxiety, and depression. This is the research conceptual model. Next, methodology. So, researcher using quantitative approach by distributing online questionnaire, and it used random sampling and self-reading method for the data collection. The questionnaire itself using Likert scale from 1 to 5. And then for data analysis, researcher using SPSS version 26 and Microsoft Excel. So here comes for the result. From 300 respondents consisting of 65% of female and 35% of male, mostly they are in the 3rd year and 4th year. The results indicated that from 8 factors that related to online learning, there are only 4 that has significantly effect on mental health. There are excessive workload, internal capability, technical issues, and learning environment. Their significance is below 0.05, which means their effect is significant. And then for the model summary, as we can see, the R-square is 0.48, meaning that 48% of the total variations of mental health are explained by this regression model of online learning, which consists of 8 factors. Next, let's discuss a little bit. So these 4 factors is not significantly affect the mental health. It might relate to the personal lives of students. For instance, students may feel worried about their financial situation, but as long as they came from a middle or upper class family, then the problem will not be that big and not that significant. Next, for lack of social interaction. This condition may be burdensome for people that have an extroverted personality, but everyone has a different personality, and maybe some of the respondents of this research are an introverted students. Then the effect may not be that significant. And then for the fear of getting infected, studies say that teenagers are fearless than adults. This may be one factor why college students are not fear of getting infected by the coronavirus, and it led to an insignificant effects on mental health. Next, conclusion. So, these 4 factors that significantly impact students' mental health. This probably because 1. The number of assignments that have piled up certainly will increase students' stress, and with a short period of deadline, this makes students keep open and stare at their laptop screen. And then 2nd, the lack of internal capabilities of each student can affect how they adapt and react to this new method of learning. If they don't adapt quickly, then it will add their difficulties and stress to students. 3rd, learning environment is the crucial part for students. Because they do online learning activities almost every day. If the circumstances didn't support them, then it may cause a big problem towards their academic performance and also their psychological. Second conclusion is there are some strategies for students to overcome mental issues. First, by understanding the situations they are living in, and then students can collaborate and have a good communications with their parents about the importance of having a conducive environment for online learning. And then students can improve their personal abilities so they can handle many jobs given during the online learning. It would reduce stress and pressure they had feel. Next, I have some recommendations for both institutions and students to overcome this. First, lecturers can assign work that are not more than the allotted credits and also give more time for students for the deadline. And then second, campus and lecturers can create a fun and exciting lecture environment, so students may not feel bored and can keep focusing on the material. Lastly, universities and government should collaborate by providing psychological services in campus, in both offline and online services, because this topic or this mental illness situation cannot be underestimated and left alone. It really matters and affects person as a whole.